think of robotic surgery, they think of the high-tech Jetsons or something on television where the robot's doing all the procedure, or like in an automotive plant when the robot's being manipulated by somebody distantly with the computer, but it's not like that in orthopedics. What the robot does is it enables us to make very precise cuts on the bone by utilizing the patient's CAT scan that we do before surgery. We know the exact size the patient needs. We know where their cartilage defects are. We can get their flexion and extension balance perfect. So we know they're able to have their leg fully extended and fully flexed, and it helps with the alignment of the procedure. So the robot uses the CAT scan information, and it allows us to be much more precise with the placement of our implants. It's interesting now that all of my total joint replacements now are robotic, hips and knees. Where we are now, in December of 2017, having had the robot since April, it's progressed to where probably 90% or more of my total joint replacements are done robotically now. And the only real constraints to not being able to do that would be if patient size precluded us to be able to use the instrumentation needed for the robot when we place the pins and have the adapters present that communicate with the robot. There are certain patients, if their size were too big, they wouldn't be able to have that done. But in more difficult cases, in patients that have had previous fractures, that have severe alignment problems with being bow-legged or knock-kneed, or have had bad accidents and have bone loss in certain areas, I think the robot actually makes it a more precise procedure and even better. So I've found my more difficult cases being done robotically, and even some revision cases now, I have done a couple of those with the aid of the robot. So I think that's where we're moving. Is I see in the future most all of the cases being done robotically. That's a really good question, because I've had some patients that come in specifically inquiring about the robot from long distances away, and then I have some patients that aren't sure about the robot or haven't heard about the robot, and when they first hear about it, I think they think of the surgeon maybe sitting in the corner drinking coffee while the robot does the surgery, but I have to explain to them that's not the case, that all the robot is a tool for me, the surgeon, to actually be more precise and make more precise cuts and have a better balance of the joint and achieve a better outcome. And when they understand robotically what that involves, they're excited about it, and then they see that in their post-operative recovery, how it speeds up their recovery. And I even have patients tell me that, Doc, I feel like I have a more, quote, normal knee now. Going up and down stairs, it feels normal again. And that's because it's so balanced with the assistance of the robot. The most interesting cases in that regard are patients that I've had that have had a regular knee without the robot, and then have had another knee with the robot, and watching the difference in the two and seeing the quicker recovery and the better range of motion and the better balance. It's really an amazing thing.